Did you know that 32,000 brain cells die in just 1 second during a stroke? If you think someone may be having a stroke, call 911 immediately because time lost is brain lost. Getting treatment quickly can reduce stroke-related brain damage and increase the chances of survival and recovery. Many people hesitate to call 911 when they are unsure of whether they are having a stroke or not. However, displaying signs of stroke is an emergency, and it is always best to call 911, even if you aren't sure, and let a healthcare professional be the one to make that decision for you. Fortunately, there are signs and symptoms to look for to help you recognize a stroke. Remember the acronym BE-FAST and ask yourself the following questions. B. Balance. Are they suddenly having trouble with balance or coordination? E. Eyes. Are they experiencing sudden blurred or double vision or sudden loss of vision in one or both eyes? F. Face drooping. Does one side of their face droop or is it numb? Ask the person to smile to help you determine this. A. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S. Speech difficulty. Is speech slurred? Are they unable to speak or are they hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? T. It's time to call 911. If the person shows any of these symptoms, even if the symptoms go away, call 911 and get them to the hospital immediately. Remember, an ambulance ride can save precious time, so a person who may be having a stroke should not wait for someone to drive them to the hospital. Emergency medical services, or EMS, can start life-saving care right there in the ambulance. They will also alert the hospital ahead of the patient's arrival so healthcare professionals can be prepared and ready to start treatment immediately. Stroke can be treatable, but treatments are very time-sensitive. Alteplase, a clot-busting medication, more commonly known as TPA, can be given to stroke patient in some cases up to 4.5 hours from the onset of symptoms. But the quicker you act, the more brain cells you can save.